Good afternoon, everyone, and welcome to our last session of Science in Progress. In Science in Progress, we've taken you in the past 4 weeks through a journey of the latest scientific research in the UAE, with today's session being our last session of the program. Before we start, if you have any questions, please post them in the Q&A tab. Our guest today is Dr. Gulfaraz Khan from UAE University. Let me just give you an introduction on Dr. Khan. His research interests are in viral pathology, infectious diseases, and public health. He has over 90 publications in peer-reviewed journals and 6 book chapters, and his publications have been cited more than 22,000 times. Dr. Khan is a very passionate teacher. He is actively involved in teaching and training undergraduate and postgraduate students. He has received several awards for his teaching and research, including the UAEU College of Medicine Award in Teaching, the UAEU College of Medicine Award for Research, the UAE University Award for Excellence in Scholarship, and Travel Award from the European Society of Clinical Virology. He is a member of the editorial board of several international journals, including a Virology Journal and PLOS ONE. He is also a member of the UAE Mohammed bin Rashid Academy of Scientists and was a nominee for the UAE Prime Minister's Medal for Scientific Excellence in 2017. Dr. Khan, it's good to have you here.
Thank you very much, Amina, and thank you very much for the very kind introduction and kind words. And it's a pleasure to be here, and thank you for the invitation.
Dr. Khan, let's start with this. Tell us a little bit about yourself. Where did you grow up? Where did you study? Who is Dr. Khan? Okay.
I was brought up in the outskirts of the city of Birmingham in UK. It's around 150 miles. That's about 220, 230 kilometers from London. I did all my schoolings in Birmingham and then went to London for university education. I studied at the London School of Hygiene and Tropical Medicine and at St. Bartholomew's Hospital Medical College. After I completed my PhD, I went to Boston, US for a couple of years. And to be honest, at one point I almost decided to stay in US. US was a wonderful experience for me in terms of training and experience. However, all my family were settled in UK. We've been in UK for a couple of generations. So all my family was settled in UK, and that eventually drew me back to UK. Firstly to Glasgow, University of Glasgow in Scotland, where I was there for about 3 years, and then took a short period out to travel to the Middle East and try to learn Arabic, and then returned back to Cambridge. So I was in Cambridge for about 2 years, and then finally a full circle back to London for 4 years. And I joined UAE University College of Medicine at the end of 2008. So this is kind of an overall snapshot, if you like, of my background and some of my travels.
Wow, you've been to so many places, mashallah.
Yeah.
Professor, what made you go into medical research, and why cancer and infectious diseases?
That's an excellent question. To be honest, let me share with you a few slides to explain what inspired me to go into infectious diseases and cancer. So as the Chinese saying goes, a picture speaks 1,000 words. So let me show you a few slides, and hopefully that will clear why I went into this. So let me see if I can share this with you. Share screen. Are you able to see my screen, Amina? Let me just...
Yes, I can see it. If you could just put it on presenter's view. Yeah.
Is that, you can see that?
Yes.
Okay, okay, excellent. So infectious diseases and cancer, I mean, these are two of the leading causes of morbidity and mortality. And this is, you know, a few slides I'm going to show you what made me go into this area. But before I go there, let me show you this beautiful building. This is where I work. This is in Al Ain. This is the College of Medicine. When I show this picture, when I'm presenting in international meetings, they always picture UAE as a desert. So when I show them this picture and show them all these trees, they're kind of fascinated by that and thinking, wow, is that where you really work? So this is in Al Ain, absolutely beautiful building. And next to this building is the Dwam hospital. So infectious diseases and, you know, cancer, well, both of these diseases are old diseases. They're not new. And I'm just going to illustrate a couple of examples to you. These are infectious diseases have been with us for thousands of years. This is an example of polio. And in fact, this relic, this relic from Egypt dates back to approximately 6,000 years ago. And what it shows is, if you can see this picture here, Amna, you are able to see my arrow?
No.
The arrow is not visible. Oh, okay.
No.
That's a shame. Okay. The slab here, you see the picture with this priest with a bent leg. The leg there is bent, is indicating paralysis. And this paralysis is due to infection with a virus called poliovirus. Now that the Egyptians did not know 6,000 years ago, they didn't know about this virus, but what they did know was that there was a disease, and this disease was present in that society at the time. This picture shows smallpox. Now, smallpox, again, a devastating disease, which the Chinese recognized some 3,000 years ago. And believe it or not only did they recognize this disease, but also they were trying to, or attempting, treatments for it. And what they actually did was that smallpox, the skin lesions, smallpox is a little bit like chickenpox. So those people who've got chickenpox, you'll see these vesicles, fluid-filled vesicles on the skin. What they did was that these scabs, dried skin from the patients, they took that, they grinded this up, the tissue, into like a powder, and then they snuffed it. So that's what is showing here on this image. The person this child is giving it like a snuff. And this is kind of an early indication. This is 3,000 years ago. This is an early indication of vaccination. So we were able to try to prevent some of these infections as early as 3,000 years ago. This is a picture, a painting from Abdullah bin Fadl al-Baghdadi, and my Arabic unfortunately is not as strong, but what this picture shows is that not only did they reckon, this is 800 years ago, not only did they recognize rabies, but they were able to show that rabies was transmitted by bite of a dog. So what you can see here is a dog biting a person. So they knew that rabies was transmitted by the bite of a dog. In the mid-13th century, we had the outbreak of the Black Plague, the famous Black Plague. And this Black Plague is estimated to have killed 1/4 of the European population. 1/4 of all of the European population died as a result of the Black Plague. Now, with the discovery of antibiotics in the 1930s, we thought that we would be able to eliminate some of these infectious diseases. Unfortunately, it was wishful thinking. To this day, we still have millions of individuals dying of infectious diseases, particularly in developing countries where many of these diseases are prevalent. This chart shows you the number of or the main causes of deaths. And last year, approximately 57 million people died of all causes. Cancer, after heart disease and stroke, cancer and infectious diseases were the next leading causes of death. Together, cancer and infectious diseases accounted, believe it or not, accounted for approximately more than 20 million deaths. More than 20 million people last year died of infectious diseases and cancer. So if one could prevent infectious diseases and cancer, one could save millions of deaths, millions of individuals from these diseases. Now, one way to look into these is what causes these diseases, what causes cancer, for example. And we know that infectious or some cancers are actually caused by infectious diseases. This gentleman, Peyton Rouse, was one of the first to show that cancer was actually caused by an infectious disease. He noticed over 100 years ago now, 1910, 1911, he showed these studies. What he showed was that chickens got cancer. So this pink here that you see is a tumor, a cancer in chickens. And he did this wonderful experiment, which changed or revolutionized some of the areas in infectious causes of cancer. What he did was he took out the tumor from the chickens, and the tumor, he mixed it with sand. And then he grinded this tissue to form a paste. And then he filtered this in a fine pore filter, which retained everything, all the cells and bacteria and everything was retained. And what came through the filtrate, the blue, he took a syringe, took the filtrate and injected that into disease-free chicken. And these chickens subsequently developed, so the red here shows subsequently developed cancer. And he showed that this cancer was caused by something which was present in the filtrate, something which is infectious. To be honest with you, at the time when he showed this, he published a series of papers between 1910 and 1912. Within this 2-year period, he published a number of papers showing that this cancer in chickens is caused by an infectious agent, but nobody believed him. And in fact, it took decades and many more studies before the scientific community was finally convinced about Peyton Rouse's finding. He was eventually awarded the Nobel Prize in 1966. That's more than 50 years after his discovery. So he was very persistent, and that's a good lesson for us to learn, that what you believe in, what your results are, you have to keep on pursuing that. So 50 years it took before the scientific community was convinced that yes, infectious agents can cause cancer. Now, currently, we know that approximately 15% of all human cancers are caused by infectious agents. And that's more than 2 million cases. More than 2 million cases of cancer. There's about 10 million cancer deaths annually. Around 2 million of these are due to infectious agents. And what's even more surprising and interesting, if you like, and intriguing, is that these 2 million cases are actually caused by just a few infectious agents. Hepatitis B and hepatitis C virus, around 30% of the cases, human HPV, human papillomavirus, Helicobacter pylori. So 90% of the 2 million cases of cancer, human cancers, are caused by just these 4 agents. Believe it or not, what triggered me to go into infectious diseases and cancer was actually chickens. As an undergraduate some 30 years ago, a long time ago now, some 30 years ago, as an undergraduate, one of my professors talked about chickens developing a very common cancer called Marek's disease. This is different to the cancer that Peyton Rouse showed. Peyton Rouse's cancer was less common. This cancer in chickens was very common, called Marek's disease. And of course, chickens dying of cancer was a problem because that had economic loss. So scientists started researching this and found that this cancer, Marek's disease, was actually caused by a virus. And once they identified that, they developed a vaccine. And this is the vaccine they developed in the 1970s. And this vaccine prevented cancer in these chickens. So the chickens lived happily ever after. Now, this concept fascinated me because I thought, if, as an undergraduate, I thought, if we can prevent cancer in chickens, why can we not do this for human cancers caused by infectious agents? And this is what has been, if you like, one of the important drivers of my research. In fact, just to give you an idea, for my PhD, I had an opportunity to go to Oxford, but the project that they were offering was not on viruses and cancer. So I declined that and went to London, where the PhD project was on cancer and viruses. That's how passionate I was. So, I mean, obviously, Oxford is, every student's dream to study at Oxford. And like other students, I was obviously, excited by it. But then after thinking about it, I thought, well, do I really want to do something which I'm not 100, my heart and soul isn't in it? So I thought to myself, no, I want to study this, and this is what I'm going to pursue. And I did. So I gave up the Oxford opportunity to go to London to study viruses and cancer. And in a nutshell, to be honest with you, I think you have to enjoy what you study, what you do. Otherwise, each day becomes kind of a struggle. You want to be able to get up in the morning and look forward to going to work. And that can only happen, in my humble opinion, that can only happen if you're really interested in what you do. And this is an important, like at least in my humble opinion, a lesson for the students out there who are listening. Do something that you really enjoy doing. So each morning when you get up, you want to go to work and you want to pursue that, rather than saying, oh, another day. You're not excited. You should be excited each day of going to work and doing what you do. So this is what actually it's the chickens again, which fascinated me, and thinking, well, can we not prevent these human cancers from by finding out how these viruses are causing that? And that was the reason, to be honest.
I completely agree with you, Dr. Khan. It's very difficult to sustain a career if you're not passionate about it. So That's a very important point for our students. Dr. Khan, I see you've traveled quite a lot and worked in several different institutions. Tell us about your experiences and how they benefited your career.
Okay, can I turn this off, the sharing?
Yes, you can, I think, stop, yeah.
Yeah, I'll just share, stop that. Okay. To be honest with you, yes, I mean, it's traveling, you know, and experience, I think in my view, it's fundamental. It's very difficult to, you know, become an expert in many different areas and different techniques. But I really truly believe that having a broad experience is a great advantage and allows you to address some of your research question. The broader the experience you have, the better experience you have, the better you are equipped to address some of the research questions, especially in biomedical science. Sometimes you have to make sacrifices in order to achieve what you want. After I completed my PhD at St. Bartholomew's Medical College, I was offered a faculty job, which I took. So I had my own lab. I applied for funding. I had funding. I had a postdoctoral fellow working with me. Everything was going very well. However, I felt that I was still in my 20s and I felt that I wanted to go and learn more. I needed broader experience. So believe it or not, I left my permanent job for a 2-year contract with, if I remember right, this is in the mid 1990s, left my permanent job for a 2-year contract with £7,000 down in salary to go to Boston, US. Now, some colleagues thought I was making an enormous mistake by giving up a faculty job. But I was very focused on what I wanted and what I wanted to achieve. What I wanted was to get broader experience. And I really believe that the sacrifices I made paid off. The 2 years I spent in Boston were very, very productive, and I gained enormous experience. And that, I believe, set a strong foundation for my subsequent career. This experience was further then enhanced while I was working in Glasgow and in Cambridge. So in a nutshell, I mean, having good experience and training is a cornerstone for a successful scientific career. Let me give you one more example to illustrate the importance of experience and training. While I was in Boston, there was a Nobel laureate. I'm not going to mention his name. And believe it or not, there was a queue of students wanting to work in his laboratory, even without pay. Now, you may ask, why would anyone want to work without pay? The fact of the matter was that these students who wanted to work in his laboratory understood the importance of experience and research, and they knew that working in this Nobel laureate's laboratory will be invaluable for their subsequent career. So yes, you have to sometimes make sacrifices, but these sacrifices will pay dividends later in your career. So I think the more research or more experience you have, the stronger foundation you will have in order to make a successful career.
Thank you, Dr. Khan. That's actually inspiring to pursue something just for the sake of broadening your experience and knowledge and following your passion. Dr. Khan, you're involved in the global burden of disease study. Can you tell us what this study is about?
Okay. The Global Burden of Disease, or GDB study, is the most comprehensive study of its kind ever conducted. It generates not millions, billions of estimates of health outcomes. The study was initiated some 30 years ago by Professor Christopher Murray, who is the main architect or mastermind behind this study. He established the Institute of Health Metrics at the University of Washington in Seattle. The Institute has several hundred researchers and more than 2,000 collaborators around the world. I got involved in this project approximately seven years ago, following an intensive summer course, which I did in global public health in Oslo. So what I did was I spent my summer, I was here at the time. So during my summer, I went back to UK, dropped my family in UK, and I spent all of my summer vacation in Norway, in Oslo, to pursue this course and this training in public health. I was particularly interested in infectious diseases that are important causes of morbidity and mortality at a global level. One of the main aims, if you like, of the Global Burden of Disease project is to gather health-related data and develop analytical tools to track the mortality, the diseases, the risk factors, and map these to each country worldwide. For example, some of the questions that this study is attempting to address are like, what are the major, or what are the world's major health problems? How well is the society addressing these health problems that we are encountering or facing? How do we best dedicate the resources we have to maximize the health improvements? So obviously different countries have different levels of resources and capacity. So this study allows us to examine these diseases and the risk factors and the resources that are available to try to maximize address these problems and how best to address these problems. The project has produced hundreds of really seminal papers in leading journals. In fact, just to illustrate to you, the data published by these studies is now being used for policy making decisions by various organizations, including the WHO, the United Nations, and various governments, including USA, UK, Mexico, Kenya, and I think Saudi are also using some of that data in order to make their policy decisions. So the project itself is now trying to, it's been going on for like I said, some 30 years, and they're constantly developing more and more innovative and detailed data and analysis. And one of the aims which is going on now is to try to map the health problems at a 5-kilometer radius. In other words, we want to know we want to be able to pinpoint anywhere in the world at a 5-kilometer radius, what are the major health problems that are prevalent in that region, and how best can we address these problems. So you can imagine in next couple of years, we will be able to say, for example, that in Al Ain, not even in Al Ain, in some Zakhar, small area within the city of Al Ain, what are the major problems? How can we best address this at a 5-kilometer radius? But the aim is to be able to do this at a global level in every country across the world. Recently, I think in a couple of years back, I think 2017, the Bill Gates Foundation provided $279 million grant for this research. So again, it shows you the scale of this study. It's an enormous study looking at the bigger picture around the world. Just to finish off with another example, I was in Washington in one of this global health conference, and Bill Gates came and gave a talk, and he was obviously funding this project. And the outcome, if you like, is so fundamental from these studies that we are now able to, even in terms of vaccination, for example, diarrhea. Diarrheal diseases are a big cause of death in children, especially under 5s. Now, there's vaccines available for some of these diarrhea, like rotavirus, which causes diarrhea in children. There's a vaccine available. Now, do we vaccinate everybody in the country? Our data, or data from this study, shows no, we can actually home in or localize to a region within a country and say, okay, this city is where most of these cases are happening, not in this city, within a country. So that resources, you can imagine this in some of the African countries, for example, where the resources are limited. What you can then do is vaccinate only the children who are being affected in the regions rather than the entire country themselves, or all the country. So again, this is how these type of data are being used to help make these policy decisions and better use the resources that we have. So it's a fantastic project, and I'm privileged to be part of this big study.
That sounds like an amazing project. But going back to your example, Professor, so you mean the children that are most likely to get it?
Yes. So we know, for example, if you diarrhea, for example, I don't know, I can take any country in the African continent or some Asian country like Bangladesh, for example. Diarrhea is very common in under 5s. Now, does the cases of diarrhea happen equally across the country? No, they don't. Our studies are showing now there's certain regions, in fact, some of the like capital cities, for example, or areas where people are financially a little bit better off, will probably have the vaccination, will have the resources, and the number of cases in those cities are far less than cities which are on the suburbs or rural areas, and in areas or cities where, or regions where the people are, if you like, not as well off and financially are in a poorer situation. So more cases are happening there. So knowing that information exactly at a country level, at a region level, we can then say, okay, this is the city or this is the region where most of these cases are happening. And therefore, with limited resources, the vaccination should be targeted towards this population as opposed to populations where the incident of diarrhea is uncommon, let's say. That's it allows us to home in, if you like, or use the resources most effectively.
No, that's very interesting. Professor, what made you come to the UAE?
Obvious questions, I'll be honest with you, because I think UAE is the most peaceful, safe, and multicultural society. I mean, I've been brought up in, like I said, with second, third generations in UK, but I've been here for almost 12 years now. And this is the longest, and as I described earlier on in my introductions, I've been around in numerous countries around the world, but 12 years I've been here in UAE, and this is the longest I've been in any one place in my entire career. So that in itself, if you like, is a testament to the fact that I must be liking it here in UAE. It's a wonderful place to work, and raise your family, and incredibly peaceful. My wife sometimes at sort of 10 o'clock in the night says, okay, I'm going for a walk, and she will walk around the block. I don't even have to worry that she's gone out for a walk, because I know how safe the country is. So, and this is what is human nature. We want to live in a place which is safe, secure, and enjoy the work. And this, you know, many people, in fact, not many, I have not come across anybody, any of the expatriates within living in UAE who have not said the same thing. Just to finish off with this, many years back, I think when I first came here, there was a colleague, and I'm not going to mention any names. The first year I was here, there was a colleague who decided to go to Australia. He'd been working here and decided to go to Australia, and he was in Australia for about 6 months. And then about 6 months later, I saw him in the canteen here at the College of Medicine. So I said to him, so-and-so, how are you? How are you enjoying, you know, working in Australia? And he had a very senior position in Australia. And I said, how are you enjoying it? And he said, well, not particularly well. And so I asked him, why are you just paying a visit to us? Or he said, no, I've left Australia. So I was a bit surprised. And I said, you've only been there 6 months and you've left Australia already? How come? And he said, and I'm quoting, he said, in the 6 months I was there, in one particular day, I was verbally abused 3 times in one day. One day, 3 times. And he said, I don't know how many years he was here for. And he said, I was here for a long time in UAE, and not once I, encountered this kind of thing. And yet in Australia, 3 times, okay, you may turn around and say this is a one-off example. But what we do know is that UAE is one of the most safest and peaceful city or peaceful country in the world. And this is and like I said, I'm here in 12 years and I'm enjoying it. So a beautiful place to live and raise and work, raise your family and work in. Yeah. I hope that answers your question.
Yes, thank you, Professor. We have some questions here from some of our participants.
Okay.
There is a question from Amal asking, how would the diameter of, I think this is related to the global burden of disease study, how would the diameter of 5 kilometers be impacted by globalization and people moving from place to place?
Yeah, that's a wonderful question. Absolutely wonderful question. Yes, we know that people move about a lot, and the global burden of disease actually takes these parameters into consideration. So we know that certain cities and certain places, there's much more movement than others. Now, of course, some rural places, the people are living there, and they're living there in the same place for years or decades. So yes, that does have an impact. And yes, we do, the global burden of disease data takes that into consideration in terms of how that will impact the number of cases in that. So this is already taken, they've thought about it. Chris Murray and these hundreds or in fact thousands of people who are working on this study looked at these issues and taken that into consideration when they work out the number of cases and the prevalent diseases.
Okay, we have another question here. Is cancer, so cancer that's caused by infectious diseases, contagious? So I think after it, yeah.
Okay, that's another very good question. Most of the viruses like hepatitis B, hepatitis C, Epstein-Barr virus, human papilloma virus, yes, they can be passed on. But the virus can be passed on, but not the cancer itself. So the cancer is not transmitted. That's not contagious itself. What's contagious is the virus itself. Now, that's an excellent question. in this country, for example, hepatitis B and human papillomavirus, we have a vaccine available already. And that vaccine is being used within UAE. So hepatitis B at birth, child is born and the child is given hepatitis B vaccine. Human papillomavirus, girls are now, schoolgirls are now given human papillomavirus, because human papillomavirus causes cervical cancer, for example. So that vaccine is being given. Now, those who are vaccinated will not get, hopefully will not get the virus, and therefore will not get the cancer. So the infectious diseases are transmittable. They are contagious, but the cancer itself is not contagious itself.
We have another question here. So Safe is saying, I would love to know how the work environment is like in the research department of infectious diseases. So it seems like Safe is interested in this field.
Okay, infectious diseases. Basically, I mean, good example of that is the current COVID-19. I mean, there's we have over 20 million cases of COVID-19 now around the world. So people are racing to try to develop vaccines for it. They're researching on it. They're looking at how the virus causes disease. So in infectious diseases, in a research-based infectious diseases, you're looking at the virus or the infectious agent. You're looking at the biology of the virus or the infectious agent. You're looking at how this infectious disease causes the disease. What are the mechanisms behind it? How, if you can understand how a given agent causes the disease, then you can intervene and try to stop this chain and try to prevent these from happening. So in a research arena, you're looking at all of these factors in terms of the organism, the biology of the organism, how it causes the disease, how you can prevent this. In a clinical setting, of course, the scenario is different. In a hospital setting, in infectious diseases, you are treating and managing patients with infectious diseases. So in a hospital where a patient is has COVID-19, for example, the doctors there, infectious diseases doctors there, will be managing that patient and treating that patient for the infection that the patient is suffering from. In a research setting, in an academic setting, in a university setting, research environment, of course, you're looking at the causes. You're looking at how it's causing it, how you can treat it, how you can prevent it. This is how you go about it. So currently, for example, there's hundreds of people looking at COVID-19 vaccine. The number of vaccines are in fact now in clinical trials, trying to establish whether these vaccines will be safe to administer to patients. All that has come about by basic research in a laboratory setting. I hope that answers Saif's question.
Yes, Professor, it does. We have also another question here. How much of your time do you spend on research?
I like to spend more, but unfortunately, it varies. I have around 6 people in my lab, several PhD students, so they take a significant amount of my time. Do I physically do the experiments? These days, I don't physically do, not many anyway. Sometimes I get involved in the analysis, and I'll go and look at the samples, and so. But on a day-to-day basis, I'm not physically involved in doing the experiments. What I do is organizing the experiment, thinking how we can address that question. What are the ways of best addressing these problems? And then I spend the time in the lab with the students, the research students, fellows, to try to guide them, say, okay, try this experiment. And of course, research is a lot of headache. I've been saying a lot of positive things, a lot of headaches, but again, it's the beauty at the end of the day that once you're able to solve that problem and that issue, it's very satisfying. So it's not easy. You don't, tackle a research question and expect that you will find the cure or you'll find the cause straight away. It takes long time to do this. And many of these, you keep unfolding. It's like a child. When a child starts walking, you'll see the child in the first, few months or a couple of months when they start walking, how many times the child falls. Each time they get up and they fall and they get up again. And within a month or two, they're up and running. That's the same with research, in my opinion. You will try an experiment out and it might not work. So you'll have to go back to the drawing board and say, okay, how can we best, look at this problem again? So yes, overall, I spend, some of my time in the research, some of my time in the teaching, quite a lot of my time in administration and meetings. So this is part and parcel of the job, really.
This brings me to another question, Professor. Advice for young students who wish to pursue a career in biomedical research.
Okay. Biomedical research, in my humble opinion, it's a very noble and selfless career, especially if you're doing it for the intentions of advancing knowledge and for the benefit of mankind. As I said earlier on, it's hard work, and it's the hard work of, in fact, if you look at it, it's the hard work of scientists that have managed to drastically reduce the many diseases, or eliminate some diseases which plagued humans for centuries. A good example that comes to mind is smallpox. I talked about smallpox right at the beginning of my session. Smallpox was responsible for hundreds of thousands of deaths. Now we've totally eradicated smallpox. Smallpox does not occur anymore. Last case, I think, was 1979 or something. So we've eradicated smallpox. How? Because of the hard work of the scientists looking into what the cause was and how we can develop a vaccine and prevent it. Diseases such as measles, rubella, polio caused millions of deaths. But now we've got them, we've not eliminated them, but we've now managed to control them to limited, very limited numbers. The COVID-19 is, as I said, is another good example. Scientists are racing to produce an effective vaccine to prevent this infection. So being a scientist does not mean that there will not be challenges and there will not be obstacles or frustrations. In fact, far from it. It's difficult, it's challenging, and very often very frustrating. But as I said, all of this gives you, when you achieve the success of being able to solve part of this bigger problem, part of this jigsaw, it's incredibly satisfying and rewarding. Just imagine if you're involved in preventing a disease which claims hundreds of thousands of lives every year. Imagine the satisfaction or the achievement one would get in trying to prevent that. This kind of achievement certainly would be worth celebrating, that you are involved in part of a group involved in preventing, tens or hundreds of thousands of deaths. That has to be an achievement worth celebrating, and an achievement worth targeting oneself to and aiming for. So I hope that, to be honest with you, I think it's my advice to the young students is pursue what your heart really desires. And if you really don't do it just for the sake of doing it. I mean, I come to work even on my vacations. I mean, I'll be honest with you, as I was speaking to you earlier on, I mean, that, I've been on vacation for the last sort of month and a half or so, but virtually every single day, even though I was on vacation, I was coming to work. Why? What is driving me to come to work? Simply because I love what I do. Otherwise, if I didn't love what I do, during my vacation, why would I be coming here? Sometimes I joke with friends that, you know, work is my first wife, and my real wife is my second wife, simply because I spend more time here at work than I do at home. So this is my first wife, if you like. I spend more time here, but this is because what I enjoy doing, and this is what I've you know spent last 35 years doing, and this is what I wanted to do, and this is what drives me to enjoy, you know, the work I do. I hope that that kind of addresses the question.
Yes, I mean, Professor, you highlight a very important point about being passionate about what you do, and I think like with the pandemic that we're now, it's this has shown us the importance of biomedical research. Professor, we have one more question here. Before we end the session, let's answer this question. Can cancer be a genetic disease?
Again, I think there's some very smart students out there, mashallah. I hope that you guys will go into infectious diseases and cancer. There is a genetic element to it as well. The best example I can give you, Amina, is breast cancer. Breast cancer is the leading cause of cancer in women. Around 10% of breast cancer is hereditary. So there is a gene which is mutated, it's called a BRCA gene, and that gene is mutated, and as a result of that, that gene the mutation is passed on from generation to generation. And women then, around 10%, so 90% is not genetic in breast cancer. I'll give you the example. So 90% of breast cancer is not genetic. We don't know what the causes are. But around 10% of breast cancer is genetically or familial, as they call it. Is genetically associated. Now, knowing that fact has opened another arena, has opened another, if you like, avenue. We now, when we screen, if there's a history of breast cancer in the family, history of breast cancer, or in other words, if somebody's mother, auntie, great-grandmother, grandmother passed away with breast cancer, then what doctors recommend is that you have a test, a screen for this mutation in this gene. Because if you have that mutation, then we can take preemptive steps to prevent you from getting cancer. How is having mastectomy, that is surgery. Angelina Jolie, I believe, the famous actor, I think she had mastectomy. So there was family history of breast cancer in there. So she had her breast removed before you develop the cancer, because there's a family risk involved in that. So again, knowing this knowledge has helped us to better tackle and prevent this cancer. Similarly, several other cancers have a smaller element of genetics involved in there, but it's not necessary. Most of the cancers are not hereditary. Most of the cancers are not passed on from parents to children and so on and so forth. Most of them are not, but there are some which have a family link in it.
Dr. Khan, thank you so much. Thank you for this very interesting session. Is there anything else that you'd like to add?
To be honest with you, Amina, I mean, I just hope that my honest and very transparent talk, based on my own experiences, has provided some incentive and enthusiasm for young students of this country to pursue a career in biomedical research. You are the future generation of the country. You need to continue to build on the foundations that have been laid by others and continue to progress. And it's an onus on you. It's on your shoulders, I believe, and I truly believe that the responsibility is on your shoulders to continue this, to make it even more successful society and country, for the benefits of the generations to to come. So whatever profession you go to, whatever sub-discipline of biomedical research, whether it's infectious diseases, cancer, genetics, it doesn't matter. Whichever subspecialty you go into, I urge you to do it to the best of your ability. Make a change. We quite often say that Ibn Sina did this and Khwarizmi did this and X, Y, Z this. They did it thousands of years ago. Can we not leave them and can we not do this now? We can, but we have to work for it. That's what the bottom line is. You cannot achieve without putting the efforts in. You have to work and strive to achieve these goals. And I urge the young generation to really pursue these aims and contribute to the society such that when we are gone, people will still say it was Ahmed who did this, it was Maryam who did this, it was Amina who did this, rather than going back to Ibn Sina, 700 years ago.
Thank you very much, Dr. Gulfaraz Khan. It was great having you. This was the last session of Science in Progress. My colleague Amal and I enjoyed hosting these sessions, and hopefully we're going to have more sessions in the future. Thank you to all the attendees and students who joined these sessions. Again, thank you, Dr. Gulfaraz. Thank you to our students, and
thank you very much.
Thank you.